I experienced an injury that occurred when I was trailer loading one of my horses. He got a little nervous and jumped, and I held on to the rope, and I heard a pop, and there was quite some instability. After a few days, actually, the pain got better, so I really didn't think much about it until about a month later. I was just simply putting on my shoe and rose my foot a little bit and heard a loud pop, and at that point I knew that something had really bad happened to my knee.
Do you remember when it happened, when she initially twisted her knee? And I remember the pop. So then she had surgery with Dr. Corbett and came back, and it was amazing. A week later, she was back at work. And I remember everyone was making comments on how are you doing this, just because the surgery was so successful.
When I was in the office with Dr. Corbett discussing the procedure, the main things were, of course, getting back to work as a veterinarian, but also getting back to exactly where I was before. I didn't want to be someone who had a knee injury that's having problems later on. I needed a knee exactly how it was before, and literally back to everything I was able to do because of the success of the surgery and because of the success of the physical therapy. So when my daughter Erin sustained a serious injury by being kicked by a horse, she was about 7 hours away from us. I got the call. I was at work when it happened, and of course it's not the call any parent wants to hear.
When you're sitting at the table with a shattered elbow, you're going to be a little bit nervous, but I had complete faith the surgery was going to be a success.
Erin had her plating done with Dr. Corbett. It was very successful. Of course, she went right into physical therapy.
Our goal, even after a catastrophic elbow injury, or any injury for that matter, is to try to get people as close as we can back to their pre-injury level of function. Because that's what we like to see, people to come in when we're finally said and done, like they can do what they were doing before, they've got no limitations, and that's kind of what I set out to try to accomplish with any given patient.
A week afterwards, I took my first trip out I watched my sister's soccer game in Foley. I was back driving again. I remember I got my hair done the next week because I was able to drive myself. And you know, ever since then, I mean, it's painful. These types of things are painful, but it truly does make a difference to have a doctor and a team who know what they're doing.
And it was nice because having had my own experience with Dr. Corbett, I was very comfortable having my daughter go with surgery with Dr. Corbett as well. When
you treat a person and then all of a sudden you start to see their wife, their daughter, or their son, and it is rewarding because that means that family has placed the trust of the medical care for their kids and younger siblings in our hands, and that's very rewarding.
I started going to physical therapy, and I was just having a conversation with Rachel, who was my physical therapist, and purely conversational. I was just saying, you know, my life is changing a little bit right now. I'm not going to be working with horses, but I need a job. Throwing some stuff out there, food service, retail, that type of thing. And then she mentions that they had a PT tech position open. And a few days later, I got a phone call that I got the job, and since then, I've just been working. I love it there. It's like a family. And I'm not gonna lie, I feel super comfortable in the place where I know all these great doctors, including Dr. Corbett, are. It's a huge family, and it's great to be there.
And there just isn't a question after multiple successful surgeries where we will go in the future.
If it wasn't for Dr. Corbett and his staff, I don't know where I would be right now. And I'm so grateful that after this super short period of time, I'm back doing what I'm so happy to be doing. I'm working, I'm riding my horse, my life is back on track, and I owe that all to them.